UCLA Lung Post-Transplant Education. Congratulations on receiving your transplant at UCLA Medical Center. You are among thousands of patients who have received the gift of life at our institution. As a transplant recipient, you are the most important part of the transplant team. The responsibility of reporting problems that may affect your transplanted organ is yours. There are many aspects of living with a transplant you must embrace in order to help your transplant last as long as possible. The goal after transplant is for you to have a new normal life, free of constraints. Over time, our goal for you is to regain strength and energy you may not have had for a long time and improve your quality of life. You may be able to return to work or school, as well as resume most of your favorite activities. The information in this presentation is essential as you start your new life with a new organ. Before being discharged, your transplant coordinator will carefully review the information found in this presentation with you and your caretakers. An average stay in the hospital following this procedure is between 7 to 10 days, and you and your caretakers will receive education every day from nurses, doctors, and transplant staff. Please pay close attention to this presentation in order to begin preparation for your discharge and share this information with any family members who may assist in your post-transplant care at home. You will require lifelong follow-up from your transplant team to ensure that your transplanted organ functions normally. It is your responsibility to keep your transplanted organ healthy by taking all medications as prescribed and by notifying your transplant team of any changes in your condition. You are responsible for making all clinic appointments after discharge from the hospital. Initially, clinic appointments may be 1 to 2 times per week after discharge. The time between clinic visits may lengthen as time goes by and you become healthier and stronger. How and when to contact the transplant team. For any life-threatening emergency, call 911. During business hours, contact your assigned transplant coordinator at 310-825-6068. For transplant emergencies after 5 p.m. on weekdays or on weekends or university holidays, please contact the Heart-Lung Transplant Coordinator on call by calling the UCLA pager operator at 310-825-6301. Ask for the Heart and Lung Transplant Coordinator on call. Identify yourself as a transplant patient and tell them that the call is urgent. The coordinator on call will be paged at home and will return your call as soon as possible. Urgent reasons to contact the coordinator. If you developed a fever above 100.5 degrees associated with any other symptom or problems, or if you have a fever that comes back more than 2 days in a row without any symptoms, if you experience any ongoing nausea or vomiting, if you have any ongoing diarrhea of more than 2 episodes, if you develop a sore throat, cold, or flu symptoms, recurrent or significant dizziness or lightheadedness, if you have new onset of shortness of breath or increasing shortness of breath, if you develop unexplained rashes of any kind, if we've requested you to take your blood pressure or are checking your blood sugar levels and either is below or above the parameters we have set for you, if you developed any unusual pain that you have not had before, or if a pain that we are aware of is getting worse. Urgent reasons to contact the coordinator. If you found that you are completely out of a medication and need a refill that cannot be handled by the pharmacy, please try to keep track of your medication supply to prevent this from happening. Remember, you should always have at least 5 days of medication on hand. For any life-threatening emergency, call 911.